So hip flexors are commonly a problem in our athletic population and in our elderly. It can be a hip capsule adhesion, it can be rectus femoris problem, it can be iliopsoas. Don't be digging in here on iliopsoas. There are too many things you can disturb in there. I like sidelying work. I've been using this technique for a long, long time, and I think sidelying is much better than the supine work. So I got Tim here on the table, who's an ultramarathon runner, and a lot of times they really have trouble with imbalance between the hip flexors and the hip extensors. When you have tight hip flexors, you don't get that long stride that you want. So we're going to check Tim out and see what he's got here. So grab the top of that leg and pull it toward your chest. You want to keep that in real nice and tight. Then I'm going to make sure he's square on the table. Just a nice little tug to make sure he's square on the table. Okay, here's the first move. Right hand brings the foot in like that. Left hand takes over, and now the hip, right? So now I have control of the knee here. This tests the distal part of what muscle? Rectus femoris. So now I'm pretty much primarily putting some force through the distal part. Now, if I want to stretch the proximal part, all I do is just bring the knee back like that. So I'm going to do this position where I have my left hand anywhere on the buttocks, as long as it's above ischial tuberosity. Right hand goes on the anterior part of the knee. I get low, get my body weight where I'm centered and happy. And then first of all, I'm just going to bring him to barrier in extension. Here we go. Couple inches, that's it. Now I'm going to play with this right here with my hip. So now I'm going to bring him into, how you doing with that, Tim? Okay, so that's his first restrictive barrier. We're going to start with this. Tim, gently push your foot against my body to the count of 5. 2, 3, 4, 5, and relax. And I simply just take up the slack there. But you've got to be careful with this because it's a lot of pressure. You don't do this if they've had knee pathology. Period. Playing with that, you okay with that? Okay, push again. 2, 3, 4, 5, and relax. Okay, now I'm going to bring him into more hip extension now that I have better knee flexion. Here we go. I'm going to get down like that. See how I've got my body? It's all done with the body. I'm not muscling them around, and I'm pushing it to the first restrictive barrier. Now push your knee forward. So now it's his knee that's activated. 3, 4, 5, and relax. And I'm going to give this a big stretch. You okay with that? One more time. 2, 3, 4, 5, and a big stretch. Ah, felt good to me. Okay. Second technique is iliopsoas. You can't do iliopsoas like that. Why? Because as long as the knee's bent, then you're just going to activate the rectus femoris, so you're not going to get iliopsoas. I'm going to get my body weight low, hand on the hip, control the ankle with my right hand, just kind of keep it loose, keep it loose. Get your body weight way low on this. I mean, look how low I am. And then I'm bringing him for the first restrictive barrier. The knee, as long as the knee's like that, iliopsoas. Okay, Tim, your knee toward your nose, gently, perfect. 2, 3, 4, 5, and relax. And I'm going to put a pretty good stretch on this thing. You okay? Tell me if it gets a little bit too much. One more time. 2, 3, 4, 5, and relax. Look how far back this thing's coming now. You talk about a lot of improved hip extension. He's going to have a longer stride in his ultramarathon running now because his hip flexors are not inhibiting that long stride. Those are my 2 favorite ways to do hip flexor work. Try them.